I'm Dr. Michael Rose. I'm a plastic and reconstructive surgeon at the Institute for Advanced Reconstruction. So foot drop can happen from a number of different causes, but the end result is that this is your foot and this is your shin bone over here, that you can't hold your foot up. So when you walk, your foot flops down, and those people have difficulty walking. They trip over their toes because they can't lift up their foot, and they have to walk with a funny gait where they're flopping their foot over and over again so that they don't trip over their toes. So that's a foot drop, and it can be mild, where you have a little bit of weakness, or it can be severe, where the foot is all the way down and you can't lift it up at all. So I specialize in a number of different procedures to fix foot drop. I can do everything from what's called a tendon transfer to restore muscular function to the foot, even when the muscles that normally do the foot function are no longer working. And I can also do nerve repair surgery when it's a nerve issue that is the problem. So we have a number of modalities available for us to fix foot drop. So the treatment options for foot drop really vary based upon what caused the problem. For example, if there's a nerve problem causing the foot drop, well, then you'll work on the nerve and fixing whatever the problem is with the nerve. If it's a muscular problem that's causing it, well, you'll do something for the muscle. So it really depends on what the problem is to determine what the solution is. And there's a combination of just looking at the diagnostic modalities that we have to figure out what the problem is, and then we can apply a solution. But there is a solution to almost every foot drop problem out there. So there's a number of ways of treating foot drop, and I'll just briefly talk about two of the most common causes of foot drop and how we treat them. If there is a nerve problem, it's typically a nerve called the peroneal nerve, which controls the muscle that lifts up the foot. So if there's a problem with the nerve, we can clean off the nerve if it's just trapped in scar, or we can repair the nerve if it's been cut in half. And usually those two things will help us restore the function of the muscle that picks up the foot. If this is the ankle right over here and this is your foot. Alternatively, if there's a problem with the muscle, we can do what's called a tendon transfer. There are ways to transplant a new muscle in there, but that's very, very rare. Most of the time what we do is we take a tendon from another muscle that's not needed in the leg, and we bring it around to take over the function that the muscle on the top of your shin does for lifting up the foot. So by bringing that tendon over and around, we can then reteach your leg to bring your foot up and down when it's supposed to as you're walking. And that's a very effective way of restoring the ability to lift up your foot, even when the muscle is damaged that normally does that. So the diagnosis is very straightforward. The patient comes in and they usually say, I'm tripping over my feet, what's going on here? So just having them walk around the office a little bit, you can tell exactly what's going on. But then you have to dig deeper to find out exactly what caused it. The combination of hearing the history of the patient, did they have surgery recently? Did they have an accident recently? Do they have any other chronic diseases that can be known to cause foot drop? And then once we've dug down into that, we can have tests. And those tests are usually an EMG test, which is test the muscles and the nerves electrically in your leg. And then we can also do imaging, such as an MRI, to look at the nerves and muscles of the leg to see what's going on with them. So whether we're doing a nerve reconstruction type of a surgery for foot drop, or we're doing a tendon transfer reconstruction type of surgery for foot drop, typically the surgery is an outpatient surgery, meaning you come in and go out the same day, but you're probably going to be immobilized for some period of time. And if we do nerve repair type of work, you're probably immobilized for about 5 to 7 days. But if we do tendon transfer work, you're actually immobilized for a few months. You become a little more mobile after about 2 months, but you're going to be going through many, many months of therapy and whatnot to reteach your muscles to do slightly different things than they did before, to allow for restoration of the ability to lift up your foot. Typically, nerve reconstruction surgery is a same day in and out surgery. Rarely does the person have to stay overnight. And typically what you can expect is the nerve will be repaired in whatever way that we've decided is the right answer before the surgery. And then we typically immobilize that part of your body for anywhere from a few days to a few weeks to let everything heal. So you'll be usually immobilized a little bit afterwards, but you go home the same day, and hopefully you'll have relief of your pain almost right away. There are some cases where a nerve has to sort of regrow to give you the relief. That usually happens after we've reconnected a nerve, because once we've reconnected the nerve, then the nerve has to regrow through that connection before the pain goes away. And that can take from 1 to 3 months in some cases. But other than that, it's usually pretty immediate pain relief.